So I'm Asha Day. I've also got a British Empire Medal, so I have Asha Day BEM. My day job is international recruitment for Leicestershire Partnership NHS Trust, and that is recruiting nurses, allied health professionals, and also looking at the medical workforce. I also have some national roles, so I am part of the British Indian Nurses Association, so I'm vice chair for those. I'm also vice chair for the Community Practitioners and Health Visitors Association because I am a health visitor and public health nurse by background. And yesterday I was delighted to be also opted and nominated and put into position as General Secretary for UPNA. UPNA, as soon as you say that to somebody of South Asian or Indian heritage, they know UPNA, one of ours, belonging, sense of belonging. And actually it's a really good acronym for Asian Professionals Networking Alliance because it sits quite nicely. So you speak to like-minded people who have the same interests, have the same philosophy of what the NHS and UPNA family bring together and how we should be actually interacting with our workforce, with our population to level out the health inequalities and improve health outcomes from our communities and our workforce. So UPNA as an organisation, in terms of what it can do for the NHS to work in collaboration, is about actually levelling that playing field for those populations. It's not rocket science, it's been known. We've known the evidence, and the evidence for inequalities or equalities work has been around since I joined the NHS in the 1980s, but it goes back to 1800, etc. So we know that. What we lack is the evidence and the ability to make those health outcomes real. What we don't do, and what UPNA I think will do, is hold organisations to account, hold themselves to account to say, this is what the intelligence says, this is what the evidence says, but how do we change them into outcomes? And how do we change them into health outcomes for different communities? You don't have to just get it right for the Indian or South Asian community, because the lessons learned there will help all vulnerable communities and it will level out the playing field for all those vulnerable communities, not just Black, Asian and minority ethnic communities. It's about the white working class lad who doesn't achieve. Actually, what can we do to him? Because he'd be the same as a South Asian lad who had the same. They're the same vulnerability factors. So it's about levelling that out. And I think because we've got not just clinicians, we've got strategists, we've got non-executive directors who can lever change, and it's about levering that change, but thinking strategically the next 5 years, the next 10 years, and then working backwards to actually where do we need to be, who do we need to talk to lever that change and also impact on those health outcomes. And it's not just about the workforce. The workforce is great because we know that from a certain band, whether you're a nurse, a medic, an allied health professional, or if you're just a porter, the career aspirations are there, but actually how many people have we got at those top jobs? How many people make heads of departments? How many people make executive directors? And we need to address that. We need to see people in those positions so that when you go out into the wider population saying, I see me, I recognise that person, that's my auntie, or that could be my auntie, that means I could do that. A bit like if I can't see me at that top echelons, I can't be there. So give those positive role models and make sure we lift as we climb so that we've got a legacy to leave at every generation. This is the first, so it's the inaugural conference. Absolutely delight to be here. It's unfortunate external circumstances have made that. The attendance. However, the attendance is still quite high. We've still got a good turnout. It's how we reflect. And also for me, the aims are still true. It's about influencing policy in terms of equalities and to deliver the parity of outcomes for our wider communities, and particularly our South Asian communities. So work in active partnership is those collaborations that we have to tackle racism and the wider inequalities field, and to create awareness about the cultural heritage, that rich cultural heritage and that cultural intelligence. So it's not about cultural competency, it's about cultural intelligence, and to make that much more understandable, to give people authority to have those conversations and to have those career conversations of where are we going. It's been an absolute delight. The conference is buzzing, and having conversations with different people and participants, they come up to you and say, this is one of the first conferences that I feel comfortable to articulate. It's one of the conferences that you've got people, like-minded people, who come out with, I understand what you're saying, I understand the issues that are going on. We have congruency within the conference because people are saying the same things to like-minded people. So whether you are an ally, whether you're a partner, or whether you are from South Asian heritage, we are saying the same thing. And we're coming out with, we need to make this happen, we need to leave a legacy, and what are we going to do the next year, because we want to come back and say, this is what we've done, this is the impact we've made, and these are the changes we've made. So we are be able to measure. So make sure those objectives that people go away with are smart and we can measure them.